Serving all of San Diego, this is your Fox 5 News.
All right, I think at some point or another, we have all heard stories of someone getting a terrible infection while being in the hospital. But what steps can you do to protect yourself and your loved ones? On today's Forefront of Health, we want to welcome Dr. Shilpi Agarwal. She's here to help us uncover some of these hazards, as we can say, that maybe a lot of people don't know about. I didn't know this, doctor, by the way. Good morning, and thanks for being here.
Good morning.
Hospital infections, the fourth leading cause of death in the United States?
Yeah, it's astounding, but unfortunately, so many Americans think that hospitals are these sanitary, very clean places, but in reality, they're places where you get so many different infections that you can actually end up there for a lot longer.
When you're talking about infections, you're talking about MRSA? Is that what happens in the hospital?
Mm-hmm. So MRSA, or MRSA, which stands for methicillin-resistant Staph aureus, is actually a type of staph bacteria, and why that's really important, as the name implies it, is that it's resistant to a lot of different bacteria that a lot of different antibiotics that we would traditionally use to treat those type of infections, and so it makes people a lot sicker and they're in the hospital for a lot longer. In fact, actually, it's responsible for about 300,000 different hospital admissions and about 19,000 deaths annually.
Okay, let's do a little game. We have some items that are here on the table. You would see a lot of this at the hospital, on the doctors, and I'm supposed to guess which one of these could possibly carry like MRSA and be able to transfer it?
Yes, so we're going to check your MRSA IQ.
Oh,
we're going to see all these are common hospital items, and I want you, Shali, to guess which of these would you think would maybe be good vectors for transmission of MRSA?
What about this?
So absolutely, this is IV tubing. Any others?
Oh, there's more. What about this?
Yeah, this is actually a very atypical one, but you'll be surprised to know that actually all of these things, plus the white coat, are ways that MRSA can be transmitted. Exactly. So let's start with the tie. So the tie, doctors wear the tie a lot, and basically if they're over patients, they're examining them, the tie can get caught in a wound. It can spread MRSA from one patient to another, and they can get infected that way. In addition, stethoscopes are extremely common medical equipment, and you'd think that, you know, that wouldn't carry any kind of risk, but it does. When you go from one patient to another, you're spreading the MRSA bacteria.
Wow.
And in fact, the CDC actually did a study where they looked at several different stethoscopes, and 89% of the stethoscopes were infected with MRSA. And
did you say 89%?
Yes, exactly, of those stethoscopes that they looked at. So it's
why
extremely,
don't they like clean it or something?
So one of the ways that you can, you know, help yourself is to have a disposable stethoscope that's used for each patient alone.
Okay.
Now, if you look at the hospital ID badge, you would never think that that's full of bacteria. But of course, again, this area along here with the fabric covered with bacteria. The coffee cup, you can have clean hands, you know, you've washed your hands, but if you pick up a coffee cup and you put it from one side to the other, now the bacteria is on your hands.
All right, we got this part. Let's talk a little bit about what you can do then to protect yourself.
Absolutely.
So obviously, I would assume that it's washing, cleaning your hands.
So the most important thing that you can do is wash your hands with warm soap and water. Using these type of gels really isn't a substitute, because a lot of times it doesn't kill the MRSA at all. In addition, what you can do is many hospitals offer protective gowns like this, so if a patient is identified as having MRSA, different family members and those that are entering the room, including physicians, etc., they're able to wear these type of disposable gowns to protect themselves. Now, that's also important because what they're doing is they're covering up their white coat, because that's another huge source of infection. In fact, that same CDC study reported that of 100 white coats that were tested, 29 of them were covered with MRSA, and the most popular areas that they found where it was growing was the elbow area, the wrist, and the pockets.
I'm like kind of grossed out right now,
Yeah,
because you would think like the hospital and all these things are just
so sterile
and clean.
Exactly.
Okay, so you know, washing the hands and doing all that, and then, but you also have some advice, like if you go home from the hospital, how to continue to, you know, keep up on all the sanitary
And that's where
aspect.
actually the most important part is. After going home from the hospital, it's really important to cover all the wounds that you have, because if you scratch a wound, that's how infection is spread. Additionally, what you also want to make sure you're doing is if you have any IV tubing that we were talking about, or a PICC line or any kind of access, that's where the MRSA is going to get into the bloodstream and cause people to be extremely sick. So know the warning signs. If you're having fevers, chills, anything like that, definitely speak to your doctor. And finally, also another important tip, finish all antibiotics that you're given, because that's how MRSA was born in the first place.
Dr. Agarwal, this is good stuff. Thank you for being here.
Thank
Opened
you.
my eyes to a lot of things. Next time I'm in the hospital, I'm going to be looking around and wash those hands.
Yes, absolutely.
Okay. We appreciate you being here with
Thank you
all
so
this
much.
information. I am sending it over to you. Chrissy! Can you believe? Chrissy has a question. No.
No question? Oh, okay. All right. Okay. Okay. So anyway, we're looking